Our evidence-based project was about effective communication with ED patients and families during the COVID-19 pandemic. The participants in this group are Elise Pape, Danny Ginther, and Megan Augustine. Our PICO question. P for the population were patients seen in the emergency department during the COVID-19 pandemic. I for intervention is charting and documentation over communication with the patient's family using a standardized tool in Epic. C for comparison was the St. Luke's North ER patient satisfaction reports. O for outcome was educate St. Luke's North ER staff members on effective documentation and charting on family communication. Effective communication with patients and family member affects perception of quality, patient outcomes, and patient safety. And to improve documentation on family communication in the emergency department.
A little background about our project. During the COVID-19 pandemic, a no visitor policy was implemented in the emergency department. Nurses and staff members have experienced a share of calls from family members requesting updates about their loved ones. Patient and family member satisfaction is affected by lack of documentation over communication during their hospital stay. There is one standardized charting tool that is available for ER nurses that require documentation over updating patients' families. However, nurses are unaware of this tool and it's not being utilized at this time right now. Heather Fritz, the St. Luke's North Patient Experience Coordinator, has gathered that family members are expecting calls from ER staff and they wait hours with no calls or updates. Some family members don't know that they have the option to call to talk to the nurse in the ER. Another concern that has come up is that patients are discharged and can't always remember what was done or what follow-up should be done after their visit. Patients and family members feel that nursing staff should either be meeting with them after the patient's ER visit or giving them a call to update them on what has been done and what follow-up should be made. The feedback that Heather has received is that these patients are overwhelmed with being alone in the ER or might not feel well enough to fully understand everything that went on during their ER visit. This is why patient and family members feel that communication could be improved in the ER setting.
This is a screenshot from Epic Playground highlighting the use of the standardized tool that was added specifically for this project. It can be found under the Quick Notes section in Epic for St. Luke's North Emergency Department only. This tool states that family has been updated on patient status and/or plan of care. This provides proper documentation of family communication.
As I spoke about in our previous slide, Heather Fritz, our St. Luke's North Patient Experience Coordinator, helped us gather information over the grievances and complaints received from the time period of February 1st, 2020, all the way till December 22nd, 2020. One example of this complaint was that a patient was an 86-year-old and the wife wasn't allowed back in to advocate for the husband. The wife had to call twice for updates but didn't receive any calls from staff to provide any updates. Out of the 116 grievances and complaints during that time frame, 20 complaints were related to COVID-19 and our lack of communication. The first article we will be discussing is titled The Impact of Patient and Family Communication in a Pediatric Emergency Department on Likelihood to Recommend. This is a level C of evidence. This article was published to identify a specific patient experience variables that predict satisfaction measured by the likelihood to recommend the emergency department. This article utilized a retrospective analysis which examines exposure of suspected risk in relation to an outcome that is established at the start of the study. The outcome in the study would be the patient's likelihood to recommend the emergency department after their visit. There was a correlation between patients' likelihood to recommend the ER with patients who were kept informed and staff to introduce themselves to the patient. The research demonstrates that by keeping patients and their families informed, there was a positive correlation with patient satisfaction.
The second article research was the assessment of nurse-patient communication and patient satisfaction from nursing care. The purpose was to research the relationship between nurse-to-patient communication and patient satisfaction with nursing care upon discharge from the hospital. This was a descriptive correlational study, and it was conducted at Siena Hospital of Trebiz between September to December 2018 on their burn unit. The majority of patients were dissatisfied with their nursing care. More than 80% did not know their nurse. There was a correlation between nurse-patient communication and patient satisfaction. The weakness of nurses' communication with their patients was evident with low patient satisfaction reports. The most patient dissatisfaction from nursing was fails to consider my opinions and preferences regarding plans for my care. Should be more thorough. Neglects to be sure I understand the importance of my treatments. It makes me feel like a case, not an individual.
Article number 3 is titled Hourly Rounding in the Pediatric Emergency Department, Patient and Family Safety and Satisfaction Rounds. The purpose of this research was to implement hourly rounding in a pediatric emergency department by the ED nurses to identify any outcomes that may affect patient and family safety and satisfaction scores. The use of the call-out during the hourly rounds was used as a measuring tool as well as family discharge opinion surveys. 200 surveys were distributed to families. 100 went to families before the hourly rounding, and then 100 to families after the hourly rounding was implemented. The data showed a decreased use of the call bell after the implementation of hourly rounding. The family discharge instructions had several questions, including my child's medical team was available to me, I had the opportunity to ask questions, the plan of care for my child was explained to me, and so on. Overall, there was an increase in satisfaction after the implementation of hourly rounding. In conclusion, this research shows that hourly rounding is beneficial to the patient and their families to keep them informed and feeling safe. Based on the research stated in the previous slides, we recommend that education be provided to all of the St. Luke's North Emergency Department staff members over effective family communication and proper documentation on EPIC utilizing the standardized tool that was created. We would also like to compare patient satisfaction reports after the education of utilizing this tool to compare reports from 2020 to the current reports.